So there are a number of tasks that we encounter in daily practice, both in terms of routine clinical practice and in terms of clinical research that I think could be helped by technological advances. Clinical care of patients with cancer and clinical research is a very data-intensive process, and particularly in doing clinical trials, there's a large amount of data that we collect on a regular basis that needs to be updated, specifically adverse events that occur in patients on clinical trials, so what sort of side effects they're experiencing.
From a technological standpoint, is ability to monitor treatment as we're treating the patient. So take their blood out and for example, and be able to monitor how's the drug doing? Should we switch to a different therapeutic? Is the tumor advancing, and can we catch this early and treat it early where we have a chance to turn the tumor back down? That I think is also a challenge, and I can imagine a lot of different technological approaches to this early, preferably non-invasive way of monitoring how we're doing and how the tumor is doing.
There are many things that could use improvement because we always need to improve things to provide patients better quality care and improvements in overall survival. But for what I do every day, managing the side effects of patients and educating them is really, really important. So things related to education of patients or families could be exciting. I don't have any ideas for how we could do that better than what we do now. Face-to-face is always good, but managing, especially in New York and in the United States, many different cultures and languages and abilities, reading levels are all very different. So if we could do something that would really speak to a patient easily, no matter how educated they were and not educated or what language they spoke, that might be exciting.
Part of the problem is that we get a lot of information at different times, but putting it all together in one easy equation or algorithm, that's really what's needed. So we want to take into account a lot of clinical characteristics of the patient, like their age or what their former therapy was or what kind of donor that we had, plus these laboratory tests, and put them all together in one big sort of solution to the problem. And that we think, because clinicians are so busy that they can't keep track of all of the different pieces of this puzzle. And so I think that that something that could bring all of those elements together and say, for this patient, you've got this kind of risk that would include both the lab tests and all the clinical characteristics. That's what we really need. So we could intervene early and help avoid some of the complications.
So I think technology has, a lot of ways that we can increase availability of knowledge, but we have to really be culturally appropriate and sensitive to the needs of communities in general, not just the white majority community.
And so one of the challenges I think right now is technological, and that is regarding how do we organize patient information so that we can look at it in the context of not only the individual patient, but all the other patients that have similar types of charts, and try to make the charts informative and helpful in guiding the treatment plan.
I think one of the biggest things that I would like to see would be a seamless communication. All the way across the board, not only for our patients while they're in the hospital, but within our patients and outside physicians, our patients with outside departments, our patients with specialty pharmacy, with LTACs, going to different long-term acute care. I see a lot of time and a lot of energy wasted just trying to get those things for the patients where we could be caring for them. That would definitely help a lot. Even as good as we have gotten, we're nowhere near where we could be.